Hi, my name is Bing Oei, and I'm a rheumatologist who's been practicing in Las Colinas for the last 16 years, and now with Star Arthritis and Rheumatology Associates. I did my internal medicine training at Baylor University Medical Center in Dallas, Texas, and my rheumatology fellowship at UT Southwestern Medical Center in Dallas, Texas. Today, I'm going to be talking to you about rheumatoid arthritis. The symptoms of rheumatoid arthritis include joint pain and swelling in multiple different joints of your body, particularly the hands, wrists, and knees. It occurs on both sides of the body and oftentimes is accompanied with stiffness in your joints, particularly in the morning. A lot of patients with rheumatoid arthritis, it takes over an hour just to even get moving. In addition to joint pain, swelling, and stiffness, rheumatoid arthritis can also cause other symptoms. It can cause weakness, fever, fatigue, weight loss, depression, muscle aches. This is a systemic disease that can cause a wide variety of symptoms. There are multiple risk factors that have been identified for rheumatoid arthritis. One risk factor is age. The average age of onset of rheumatoid arthritis is between the ages of 40 and 60 years of age. Another risk factor is sex. Rheumatoid arthritis tends to affect females more than males. Another risk factor is smoking. This is the one environmental risk factor that scientists have found that have a high association with rheumatoid arthritis. Another risk factor is obesity. Having a higher body weight is pro-inflammatory and may confer a higher risk for rheumatoid arthritis as well. These risk factors are all taken into consideration when considering a diagnosis of rheumatoid arthritis. Rheumatoid arthritis is diagnosed based on multiple different clinical criteria. We use a combination of history, physical exam, blood work, and imaging to confirm a diagnosis of rheumatoid arthritis. In terms of history, we look for the presence of swollen and tender joints on both sides of the body, accompanied by profound stiffness in the joints, particularly in the morning. We also look for positive blood tests. 85% of patients with rheumatoid arthritis have specific markers for rheumatoid arthritis in the blood. We also look for the presence of inflammation in the blood using inflammatory markers as well. On physical exam, we look for the presence of tender and swollen joints. We examine multiple different areas of the body, including the shoulders, elbows, wrists, knees, hands, hips, as well. Sometimes we'll use imaging as well to confirm a diagnosis of rheumatoid arthritis. Rheumatoid arthritis, as it advances, will sometimes cause radiographic changes if left untreated. In the 21st century, we have multiple treatments for rheumatoid arthritis, ranging from treatments for supportive care to treating the actual disease itself, and multiple ways of administering the treatments. There are different types of rheumatoid arthritis treatment. We have supportive treatments such as anti-inflammatories, which treats for pain, but we also have other treatments such as steroids that treat for acute flare-ups. But for treatment of the disease itself, we like to use disease-modifying anti-rheumatic drugs. These include methotrexate, leflunomide, sulfasalazine, and hydroxychloroquine. Another class of medications are the biologic agents. The biologic agents come in a variety of different ways of administration, from IV infusions to self-injections. At Star Arthritis and Rheumatology Associates, we offer intra-office IV infusions. Examples of IV medications include Remicade, Simponi, Orencia, Actemra, rituximab, and Reclast. Examples of subcutaneous injections include Humira, Enbrel, Simponi, Cimzia, Actemra, Kevzara, and Orencia. We also have newer oral agents that also include Rinvoq, Olumiant, and Xeljanz. These traditional DMARDs and biological DMARDs are used to reduce pain and inflammation in rheumatoid arthritis and also to try to induce remission. Although there is no cure for rheumatoid arthritis, we have now multiple medications and tools at our disposal to try to control the disease and put it into remission. Thank you for listening and watching our video today. We hope you found this information very helpful.